All right, we are here with Dr. Ali Navidi. Dr. Navidi is a licensed clinical psychologist and the co founder of GI Psychology, which specializes in GI disorders and chronic pain. He's the founder and past president of the Northern Virginia Society of Clinical Hypnosis. He's given national talks at institutions like the UNC School of Medicine, Georgetown University. He's been on multiple podcasts, been on TV. His work has been featured in the Washington Post and the Atlantic. So he is very well known, and we're very lucky to have him on. Personally, I've known Dr. Navidi for quite a few years and love his approach to helping people with chronic pain and GI issues. So I'm really excited to dive into this today. Ali, thanks so much for joining.
Yeah, Jesse, I'm glad to be here and just to have an excuse to talk with you more. I've always enjoyed hanging out with you, so let's get
It's always
started.
great. It's always great catching up.
Yeah.
Our big message is, we want to help people who like to exercise and be active. So I always like to ask people if you could only do one form of exercise for the rest of your life, what would it be?
Yeah, so before the pandemic, I probably would have said soccer. I was
Okay.
playing I was playing a lot of indoor soccer. And then at some point I got like near the pandemic time I got really terrible concussion, like
Oh,
bad. Um, and at that point, my wife was like not super supportive of me playing indoor soccer. So, to appease her, I decided to do a combat sport. Um, so
much better.
now, so now I do Brazilian Jiu-Jitsu. So that would be the sport, if I could keep doing. So I've been doing that for the past 2 years. It's been really cool because I do it with my son who's 18 now and is going away to college, and it's been a nice bonding thing together, and um, it's got a nice community aspect to it. So I'm part of the morning crew. We get up early, we do our class at 6 a.m. and we think we're better than everybody else because we're up so early. That's kind of the joke.
No, I think that's. I mean, we have a lot of people who brag that they're the 5 a.m. class or they're the 6 a.m. class, and they love to tell me that they're the 6 a.m. class. So I think I think that's pretty common.
Yeah. Yeah.
So tell us, Ali. Who's the type of person you like to help the most, and how do you do it? Just in broad general sense.
Yeah. So I'm a clinical psychologist, and I got into this field, maybe, um, well, I got into it like out of college. I was doing like biochemistry, right? So I was kind of off base a little bit, and I was gonna do a PhD in biochem. Luckily, my wife saved me from that, and because I was spending all my time reading about psychology, reading about hypnosis. So anyway, long story short, switch gears, and then about 13 years ago, started doing my own private practice, and I pretty much thought that was all I was going to need. Um, and very slowly, because I had an interest in clinical hypnosis and I helped found the local chapter, um, I started getting more patients with chronic pain, and I started getting more patients with GI problems. And early on in my career, I did not realize what a powerful tool clinical hypnosis was for those two types of problems. Um, and then I also didn't realize how few people are trained to actually help people with those problems, specifically with the GI problems. So once kind of word got out amongst the doctors and amongst the patients, it became more and more of my practice till eventually it was like 80% of the work I was doing was with patients with some kind of GI problem. Often these were complicated patients, so they had chronic pain. They might have chronic headaches and musculoskeletal problems also, as well as GI problems. Um, but it turns out that the combination of CBT and hypnosis are crazy effective, and I can talk a little more about that. But so I ended up really falling in love with helping patients with those kinds of problems.
That's great. So there's a couple things there I'd like to dive into. So I think there's a couple things that people might not understand. One is hypnosis overall, right? I don't. A lot of my clients who I recommend see you, there's kind of a misconception around
What?
hypnosis. Yeah, exactly. And then also, GI issues and psychology don't also
Yeah,
often, people don't connect those dots very often. So, I want to touch base on both of those. I'll let you pick whichever one you want to dive into first, hypnosis or the connection between psychology and GI issues. Talk a little bit about one of those two things.
yeah. Um, yeah, and I think it's really astute of you that you brought up those two things. And and those two things that you brought up kind of solve a bigger mystery. So let me lay out the bigger mystery. The bigger mystery is we've got, and I'll lay it out for you guys. So we've got a disorder. Let's just talk about IBS, for example,
Great.
irritable
Let's make
bowel
it. Let's
syndrome.
make it. Let's make it simple. Yep.
Yeah, keep it simple, right? It affects about 45 million people in the United States.
Wow.
Whoa, right? 1 in 10 will have IBS at some point in their life, right? That's a lot of people. We don't have good drugs for it. Diet helps a little, but not a lot. We don't have good treatments for it, except for these very specific type of behavioral treatments. In fact, the research on these treatments has been around for 40 years, which is crazy. And they're really highly effective. They have about 80% effectiveness rate. There's been over 100 studies done on them, right? So the mystery is, how could we have so many people with these problems? We could have treatments that are well studied, like study after study, really highly effective and short term, so about 10 sessions. How could that not be just like everywhere, right?
That would be exactly my question. That's
Yeah.
exactly what I was thinking of. What I was going to ask next. So thanks for making my job easier.
And the things you laid out are the things I think are the reason. So first off, it's very counterintuitive. When you come in and your stomach is hurting and you go to the doctor, how do you get from my stomach is hurting to I'm going to see a clinical psychologist? It it doesn't make sense. It doesn't compute. It doesn't work. Um, so that's the first barrier. And the second barrier is anyone who hears the word hypnosis um, immediately is like, okay, I don't want to get involved in that, right? So let me start with the first one. So how do we get from the stomach to the brain? Um, and so there's something called the brain gut axis. And that is something that science has been studying now more and more. And they've learned that the connection between the brain and the gut is very powerful, meaning more so than other parts of the body, the brain influences what the gut is doing. And the gut actually influences what the brain is doing. The majority of the neurotransmitters that are created in the body, they're in the gut. They're created in the gut. The gut has like a little nervous system. It's called the enteric nervous system. So it's got this like little brain. And so our little brain talks to our big brain and they affect each other. And so once you begin to understand the brain gut axis, then you can see, okay, when somebody starts developing these disorders, what's happening in their head is affecting their gut. And then there starts to be this feedback loop that can kind of run out of control. I mean, I can go into like the model of like how that works exactly, but the basics of it start with the brain gut axis.
No, I think that makes a lot of sense because I think intuitively people understand that things like mental stress and other factors can impact their physical health. Right? We all know that if we're stressed for a long period of time, we're more likely to get sick. I think
Yeah.
more people are starting to understand. In my field, stress can definitely impact how likely they are to have pain. So it's not very surprising to me that the gut and the brain can actually speak together as well. It's interesting that it goes in reverse order as well, where the gut speaks to the brain as well. So I don't think it's a big jump for people to uh, understand that there can be an impact. But you're right, like it's not intuitive where someone's like, my gut, my stomach hurts, so I better go see a psychologist.
Right.
And then I would agree as well. Let's talk a little bit about like hypnosis. What I think there's a lot of misconceptions around that. Can you simplify that and help us understand what does that actually look like? What does that mean?
Yeah. So let me lay out one thing that happens, one little bit of the model in brain gut problems. So somebody with IBS comes in and they've got basically the brain gut axis and then three key variables. One is something called hypervigilance. That means they're scanning their gut and looking for problems. And we see that, as you know, probably in a lot of like chronic pain disorders as well.
I couldn't. I was just again thinking the exact same thing. That's such a common thing in people that have chronic pain. So again, not very surprising this shows up in IBS.
And actually, what I'm going to lay out here as a model for GI, this is a certain class of GI disorders called disorders of gut brain interaction. IBS is one of those disorders, but there's about 29 other disorders. So IBS is one of them. But this model actually works for a lot of chronic pain disorders too. So we've got hypervigilance, and then we've got a scanning of the area of the body. For now, we're talking about the gut, but it could be their shoulder, it could be their knee, it could be whatever area. And then when they find something, oh, that feels a little weird. Like I don't know about that. Um, then you get this catastrophizing. They start worrying. Maybe it's screwed up. Maybe my ligament's torn and I don't realize it. Or if it's their stomach, maybe I'm gonna throw up. Maybe I'm gonna get diarrhea during that meeting. Like they start catastrophizing, and then that catastrophizing sends anxiety down into the gut. And because there's such a powerful relationship between the two, then the gut starts creating symptoms. It starts tensing up, cramping, doing all kinds of stuff. And then there's one last piece of it called visceral hypersensitivity. And that's where the brain essentially like turns up the volume on a sensation. So what feels to me like just like I'm a little hungry could be to somebody with IBS as pain. Not because that sensation represents dysfunction, but because the brain has just cranked the volume up so high. So I explain all that to get back to hypnosis. So what is, yeah, sorry.
Can I just let me make sure I understand here, and
Yeah,
also
yeah.
kind of maybe simplify and break it down. So a lot of times, what you see, and I'm assuming this is not with everybody with IBS, right?
This is with everybody with
Oh,
IBS.
okay, I take it back.
Yeah, yeah.
So we have an issue, and then we start to think about that issue more, and we start to constantly, like you call it, scan and say like, do I have issues right now, or do I not have issues right now? And then you start to feel a little bit of something which may or may not be an actual problem, right? Like you said, like you might feel
Yeah.
hungry, but because you're scanning and because you've had this past experience, your brain starts to, as you call it, catastrophize, or we can just say your brain starts to kind of freak out a little bit, and that then continues the loop of issues. Is that pretty much it?
Yeah, that's pretty much it. But let's add a little caveat. Often this cycle starts with something real, like
Yep.
a structural problem. So
Yep.
maybe they get food poisoning, maybe they get an infection, a virus. If we're talking about chronic pain, maybe there is an actual injury of some
Yep.
kind, right? But after that is done, after the infection is done, the food poisoning is done, um, the brain still is viewing that area with fear and suspicion, right?
Yeah. I mean, we could we could easily just. I'll have you on again, and we can easily just change the word GI to chronic pain, and this is the exact same
Yes.
process.
Yes.
So that's really interesting to me. Okay, so now we kind of understand that. So how does now hypnosis break that cycle, and also what does hypnosis even look like?
Yeah. And so to kind of give the framework, there's two major treatments that have tons of evidence. clinical hypnosis, and specific forms of CBT. Not general CBT, but specific forms. Okay, so clinical hypnosis, what the heck is it? Now, the unfortunate thing about clinical hypnosis is the vast majority of people, what they know about it is what we'd call entertainment hypnosis, right? So if
That's all
we
I know.
take, yeah, if we take entertainment hypnosis out, which means we're taking everything you've seen in movies, all the television shows, the stage shows, the mind control, the magic, all that stuff, what's left? In most people's mind, not much, right? So what are we actually talking about? It's pretty straightforward actually. So what is it? It's just deliberately teaching someone how to go into a state of trance. And a state of trance is a state of consciousness that we all experience throughout our day. And I can give some examples of what that is, but I'll pause for a second because I know. Um,
No, I'm with you so far. I've got a follow up question on that, but I think you might be answering it in 1 second. So I'll
okay,
let you keep going.
so what is trance? Trance is happening all the time. When I go for my run, like I'm running around the lake, and sometimes I'm going through periods of just like, when will this end? This sucks. Please make it stop. And then sometimes I'm just in my own head. I'm not even aware of my body, and everything's running kind of automatically. That would be an example of trance. Um, if I'm reading a book and I just totally get into it, and I'm lost in the ideas and the thoughts of the book, that's an example of trance. I have two teenagers. If I give them if they have their phone, they're almost automatically in trance. Like boom, done, right?
So it sounds very similar to what people often call flow state.
Yeah. Flow state would be a subset of trance.
Okay, great.
Yes. Yeah. Um, so trance is happening all the time when we do road, like we get that, like, was it road hypnosis they call it, or something like that, where you kind of get lost driving. So we're always going in and out. Even if you're listening to a lecture or listening to somebody talk, you're gonna like go off on your own thoughts for a bit and then kind of pop back. Um, these are all normal examples of trance, and so what we're doing is we're teaching people how to do trance on purpose instead of accidentally. And why do we care about trance? What does trance do for us, right? Um, well, one of the things people can learn how to do in trance is take that visceral hypersensitivity that I mentioned earlier and turn down the volume. So now that sensation that's coming from their gut that was from like being hungry feels like they're hungry again instead of that sharp pain because the volume was turned up so high.
Right. So it sounds like hypnosis is a lot less, for lack of a better term, woo woo than a lot of people think it is. And we're actually, maybe inadvertently going in and out of kind of on our own, hypnosis on our own. And you're just giving us tools to do that even more. Is that right?
Yeah, we're giving you tools to do deliberately
Yep.
what you were doing kind of accidentally. And athletes love it. Athletes love hypnosis because it can help them enter that flow state, more easily. It's a great tool for affect regulation. So if you're feeling nervous, if you're feeling jittery, it's a great way to kind of reset and just feel calm.
Maybe this is subset or even simplifying it too much. Mindfulness or meditation, are those forms of trance or separate?
Yeah, that's a great question. So I would say that mindfulness and hypnosis both utilize the trance state,
Okay.
right? And they're just doing different things with it.
Okay.
Mindfulness is about building up that like metacognitive awareness, like focus on your breathing. When you get distracted, bring yourself back.
Yep.
Keep focusing. So it's you're building that ability to like be aware of your own thinking.
Yep.
Whereas hypnosis, we're often using it in this kind of work to influence the mind-body connection.
So
Because in trance, we're much more able to use that mind-body connection than we are in our normal state of consciousness.
So one analogy I often use with people in chronic pain, so I'm curious if this applies to GI, is when you've had pain for a long time, your body's alarm system becomes very sensitive.
Mm,
So what I just an analogy I often use is, your alarm system at your house. If it goes off when someone's breaking in, that's an effective alarm system.
yeah,
If it goes off every time your dog comes in the doggy door, that's you know the alarm system isn't actually that effective, and it's creating more problems than it's solving. So in people with pain, what I say is, once you've been in pain for a long time, your alarm system becomes very effective and almost too effective, and it starts going off when the dog comes in the dog door, and that doesn't necessarily mean that something's wrong with the cartilage in your knee or anything like that. Is that a similar analogy where with chronic IBS or chronic GI issues, your alarm system is telling you something's wrong when maybe there's not actually something physically wrong? Or maybe there is something physically wrong, but it's your brain is then, saying this is scarier than it needs to be.
100%. And getting back to one of the things we were talking about earlier is if people are starting to have GI pain, of course they should go to their doctor first because the doctor needs to rule out certain, dangerous things.
Yep.
Um, but once they rule those things out and they tell the patient, hey, your blood tests are good, your scans are good, often patients react with disappointment. They wanted the doctors to find something because then they could fix something. And I want them to understand that finding nothing is amazingly good news because these chronic GI pain, they are very treatable. And so what you were saying about, and it's kind of like what we say the same things. Um, Pain does not mean harm. Pain does not necessarily mean damage, right? Just like you said, pain is an alarm system, just like anxiety is an alarm system. And as we know from anxiety, it's not always accurate, right? Like, think about the vast majority of people, if you ask them to give a speech right now, their anxiety alarm system would be going off like they were about to be executed,
Yep.
like about to be lined up against a wall and just shot, right?
Yep.
Are they in actual danger that's equivalent to the amount of anxiety that they're feeling? 100% not, right? So just like anxiety as an alarm system often needs to be calibrated, right? Pain is the same way. So
Yeah, and I
pain,
think I think one
yeah,
thing that I have to often make sure I educate people with, and when I started using this approach more, I actually made this mistake too often, is not letting them know that, the sensation is real. So if we use anxiety, like, the
yes,
anxiety is real. Like, we're not downplaying your pain, we're not downplaying your anxiety. Like, those are real sensations. They're not made up in your head. What we
yeah,
try to do is say, the anxiety might be real, but is the situation as dangerous as the anxiety makes it seem? Is the
yeah,
pain as severe, or is the actual tissue damage as severe as your pain is saying? So I'm assuming it's the same way, right?
yeah,
The symptoms of IBS and GI, they're not made up in people's head. There is an issue. It's just there's a cycle between the psychological aspect and the physical aspect that, if you don't take care of both of them, it's hard to fully fix the problem. Is that fair to say?
yeah. Yeah, it's that phrase just in my head. I
Yeah,
hate that phrase,
it's
right?
the worst.
Yeah, it's because everything is in your head. Like any sense that you can't feel anything if you don't have a head,
Yep,
right? You could have a very nice body, but if you don't have a head, you're not going to feel a thing, right?
yep,
So every sensation we have is in our head. Um, Now, their pain, 100% real. You know, um, the symptoms of IBS, so usually you're going to have like diarrhea or constipation plus some degree of pain. Those are kind of the three things that make the criteria for IBS, and all of them are real. And And so what you get is something that's being maintained by this pattern between the brain and the gut, but it's causing real pain, it's causing real diarrhea or real constipation or real cramping or real, these are real things happening to the body. But the question always is, what's the lever that's going to be most effective to change the system, right?
Yep.
And once people understand that their brain is actually connected by their neck to their body, then they know, like, okay, so what we do in our head actually affects our body.
Yeah, so I'm glad we touched on that because I think it's really, really important for people to understand that we're not saying whether it's pain or GI issues, we're not saying that it's made up in your head. It is; these are real things. But like you said, which lever can you pull? So one thing that I find with people in pain, so I'm curious how you deal with this situation. People aren't usually quite ready to start down the road of, hey, I need to work on my mindset for my physical issue, or they're not
Mm-hmm.
ready to. They're not quite there yet. Maybe they're early on in their process
Right.
and they still want to work on the physical aspect of things. So what do you say to those people who they're just not quite there yet, or they don't think you're the one to help them, or they don't think whether it's you or somebody else, they don't think that
Yeah.
they're the one that psychology can help with their GI issue. How do you talk
Yeah.
through that person?
So people, like we work with this long enough, you see that people are kind of on different stages of a journey, right?
Yep.
And so when I first started doing this, years ago, I was kind of and this is a bad way to put it, but I was kind of like the trash can in terms of treatment. I was the last place people would go. They would have been scoped up and down and left and right and gone to multiple gastroenterologists. And so it would have been years of pain and suffering before they found their way to see me. Um, the field has evolved, right? Doctors are talking about this earlier in treatment. I was just talking with a gastroenterologist last week, and they were saying when a patient comes in and they see their symptoms, they can often get an idea that this might be, let's say, IBS, and they'll say, "Hey, look, I think this might be IBS. We're still going to do all the tests, but if they come back negative, this is good news because there's a lot of good behavioral health treatments that we can do for this." So they're kind of like letting people know earlier. But to your question, if people are still on that journey of I want to find the thing that's wrong, I'm not going to stop them from going on that journey, right? And I can't tell them, and if they're saying my pain, I think there's something very wrong, in my gut, something that might be killing me, and the doctors just missed it. I'm not in a position to tell them they're wrong. I'm in a position to maybe say, well, the three colonoscopies that you've already had, nobody has found anything wrong. So we might want to consider that there's a brain gut connection here. Because I don't want people wasting their time looking, for another colonoscopy or whatever.
Yep.
Um, but it is hard if they're still on that journey of finding the thing that's wrong. Um, they might not be ready for this kind of treatment. Once, if they believe their doctor, if they trust their doctor, then often that is a good road in. People often come in very skeptical. They're like, look, my doctor said there isn't anything structurally wrong here, but I'm not sure about all this. That's fine. Come in skeptically. That's probably the majority of people. Um, I think the first time they start doing hypnosis, this isn't. It doesn't take long to start seeing results. Like often it's by the fourth session, people are starting to notice some positive things. So it's going to kind of deal with itself if they just give it an honest try. Um, but yeah, they have to be at least minimally ready.
And what I often tell people, and I'm assuming this applies the same, is you don't have to do one or the other. You don't have to do
Yeah,
tests or treatment. You don't have
yeah,
to. So for in my world, people often say, should I get an MRI or should I start physical therapy or should I go to the doctor? Well, why don't you do all of them at the same time, and you
yeah,
don't have to then wait on one to then start the other. You're kind of extending your journey in that way. There's nothing
Yeah.
wrong with, sure, get your MRI and come see me and also go see your surgeon. Do all three at the same time. So for you, I'm going to guess it's the same thing where by all means keep getting your tests done, but why don't we also work on this mind gut connection at the same time so you don't have to keep waiting to actually see results?
Yeah. Yeah. And that's in an ideal world. I think that's the way it should go. Like the doctor says, okay, I think this might be IBS. We're going to go through and do all these tests. We're going to schedule you out for your, to get scoped, whatever. And at the same time, you can start working on this brain gut connection. And guess what? If by the time you get to your colonoscopy and you're already feeling better, you don't have to do it.
Exactly.
Yeah.
I tell the exact same thing to people. So I think that's great. So I don't want to put words in your mouth, but it sounds like the person you can help the most is somebody who has gut issues, diarrhea, constipation, pain are the three big things you said,
Yeah.
and they've had some physical tests, and those tests haven't shown much. That's the type of person who probably will benefit from hypnosis and working with you. Is that what I'm hearing?
Yeah. Yeah. So there's this whole this thing, like I mentioned earlier, disorders of gut brain interaction. And there's like 30 different disorders. So some of the most common that come to my mind would be IBS. So that's what I described. There's something called functional dyspepsia. And so that's where people are getting bloated. It feels like food is just kind of sitting in their stomach, super uncomfortable. They're often they lose their appetite. They start like kind of losing a little bit of weight. Um, there's disorders where people are vomiting, and it's not because of an eating disorder or anything like that, or they're getting nauseous, or they've got chronic nausea, or some kind of chronic pain in their gut. Um, so there's a lot of these different disorders, and they're all kind of treatable in the same way. And before, and so a little bit of my story is, so I was doing this kind of work, for 13 years. I'm still doing it in this DC metro area. But at some point I get full, right? I can't see more people. And there's thousands and thousands in this area, maybe millions. So I decided to start a bigger practice. And the goal, and the practice is named GI psychology. And the goal is I want to make this treatment available to other people, um, that it wasn't available to, because there are literally about 500 people that are trained to do this gut brain type of therapy. And that's crazy considering how many people have this problem, right?
Yeah, that's not very many people. That's not very many providers.
No, no, it's so ridiculously small. So I started this practice with another clinical psychologist, Dr. Duffing, and our goal is to train more people and to get the word out to doctors and patients that these are available. So these are the people that we can do an amazing job helping. Also, people with what's called inflammatory bowel disease, so IBD, so that would be like Crohn's and colitis. We can also help patients with those disorders, although the story is a little different because they do have actual structural issues going on. They've got ulcers, they've got like inflammation, they've got things that are happening. And that's a whole other conversation, how we can help patients like that. But those would be the majority. And then maybe for another discussion is we work with a lot of patients who just in general have chronic pain.
Yeah, we can dive much more into chronic pain later because that's my world.
Yeah, exactly. Exactly.
So I think you mentioned it earlier, but you know, what does very broad terms? What does a course of treatment look like with you? You said people can often see success within 4 sessions.
Yeah.
So what like are people working with you for months? Are they is it a few sessions? What does that look like?
Yeah, so when we look at our data, when we look at the research, they're kind of in line with each other, and it's on average about 10 sessions. If you think about those sessions as being weekly, so then you've got, a little more than 2 months. People often see some improvement starting around the fourth session. And so the course of treatment would be, they'd call up our clinic. They'd schedule a free phone consult. We've got a clinically trained person who can lay it all out for them and answer all their questions. They get scheduled. They do what's called an intake. We're gonna do a full assessment. And why are we doing a full assessment? Because a lot of these patients have comorbid mental health issues, and we can help them with those issues, but we need to like figure out the whole picture in order to figure out where we want to start, right?
Yep.
Um, so let's say we have a very simple case of just IBS. We do our assessment. We start introducing them to clinical hypnosis and CBT in the second session. And then after that, let's say some patients need more hypnosis, some patients need more CBT, but let's say it's a average case where they just need kind of 50-50 both. So then after that, we'll usually do a hypnosis session with some CBT work kind of integrated into it for each session after that.
Okay. So
And then
it's not,
we make recordings for the patient. They can take it home and practice also.
okay, great. So it's not, people don't need to see you for 6, 9 months to see progress. And that's
No,
great.
now they might if we're also treating the comorbid disorder. So
Sure.
anxiety, depression, trauma, all that stuff.
Sure. So treating the symptoms, but also addressing maybe some other things that are underlying and might have contributed to it in the first place.
Exactly. Yeah.
That's great. So what's one message you would want people to leave with, or what's one piece of health advice you wish more people knew?
Yeah. I hope if they get something, because I know anyone listening to this either has a DGBI or knows somebody with a DGBI. I can guarantee it. I've had too many conversations with people. So the thing I'd like them to take away from this is they don't have to just live with this stuff. And they do. Trust me, at this point, most of them are. They're just living with it and they have to adapt their life to it. They don't have to live with it. There's very effective treatments out there that are not woo woo and, crystals and magic. They're solid treatments that are backed by, like I said, 40 years of research. So don't have to live with it. And if you have a loved one with it, talk to them about it because there's definitely help.
I love that message because we tell people the same thing with pain all the time. Like way too many people just live with whatever condition they have. So IBS or GI issues or pain. So I love you telling people like, hey, there's other options out there that you probably haven't tried. You don't have to keep modifying your life around your condition.
Yeah, exactly.
Allie, this has been great. So if people are interested, how do they find you? Where do they find more information at?
Yeah, the website is pretty simple. It's just gipsychology.com. So gipsychology.com. Go there. They can get a free phone consult, get all their questions answered, and they can get started. It's pretty simple.
That's great. Thanks so much for your time, Allie. It was great talking to you. Great catching up.
Yeah, really fun talking with you. And I had to restrain myself so many times from just diving in and talking about chronic pain as well.
Yeah, we can go much more into that later, but I don't want to keep you for too long.
Yeah. Thanks a lot,
All
Jesse.
right. Thanks, Allie.